Sharing. I want to share screen. All right, mic check. Good. We are rolling. So let us look at, and we got to look at a whole bunch of them because some of you walked into traps that I already told you I made. Question.
Is there any way to get the sample back to study from for exams like this?
Nah, can't because you guys got to develop that skill set because if I just keep on giving you sample questions, I did it on purpose last term because why? You need to know my style. You'll be seeing it again, and my style is very NCLEX-y, and I do it on purpose. Right? You guys got to develop that skill set. And if you look at all the ones that we got wrong, that you got wrong, there's a lot of those. Some of you are rushing still, and others you're just simply not doing. You're not reading the question. Because some of you are still doing game show mentality. Like when you see, did you see now my new trick is I give partial correct answers. So it makes you jump on the first part of the question, but then the second part of the question is what? Wrong. Right? So you jump on it and it's wrong. If you do your process of elimination and you slow down, because class average like for 50 items is like under 30 minutes. That's still really, really fast. So let's look at the first one, which a bunch of people got wrong. And remember, I even stated that you last term we saw an issue with medical terminology. So I was going to incorporate more medical terminology. So the first question was leukocytosis, right? So right off the bat, leukocytosis, is that increase of white blood cell or decrease? Increase. So if you have an increase of white blood cell, oh, that was a straightforward question. I'm just curious why 4 or 5 of you still got it wrong. That one was just straight up medical term question. The next one was, again, another straight up question. My patient has a parasitic infection. So what part of their white blood cell differential should be up? So definitely, of course, know your white blood cell differential. So cytosis versus penia. Know that. So cytosis is what? Too much. Increase. Yeah. Oh, very nice. So cytosis, of course, too much. So if my patient has erythrocytosis, they have what? Too much. If they have erythropenia, they have what? Too little. And the next one was, of course, know your differential. That's a given. Which one's which? Which one increases in, which one's the first one, or acute bacterial infection? Of course, that's PMNs, that's your neutrophils. Which one does histamine and heparin? You know that's basophils, and they're related to mast cells. So we already know that one to death. But again, still several of you got it wrong. Next one. I even prefaced even during the Tuesday session, which was recorded, that link the plasma proteins to the formed elements. And remember, the formed elements, if you look at the chart, it was on the left side of the chart. It is the dry part of blood. The plasma is the wet part. Where will you find the proteins? In the dry part or the wet part? The wet part. That's why they're called plasma proteins. Now, the question asked about which plasma protein deals with clotting. So you have the 3 choices is what? Albumin. What's another one? Immunoglobulin and fibrinogen. So those are only 3 viable choices. Why did I put platelet there? I put platelet to see who would bite. Well, 5 of you bit. Because again, game show mentality. You saw clotting, you didn't even read the question. You saw clotting, and then you saw platelet. and then did what? That's the answer. And then, did you do your protocol and even check? Is a platelet a plasma protein? No, right? It's a formed element. So what were we looking for? Plasma protein. And what is the plasma protein that's involved in clotting? So know your differential and know your plasma proteins because they are big on clinical stuff. It's one of the main reasons why we spin blood. Next one. Ugh. Why does this one look ugly? This one it's progressively worse. Now this one was a double, right? Again, polycythemia of my red blood cells. I mentioned polycythemia rubra, but we already know that poly means what? Many. So if I have many red blood cells, right? And you got to think about your, let me draw it on here so it'll be on video. You have to think about your hematocrit like this, just like the drawing. So if your hematocrit is like this, it's like the tube, right? And let's all the red stuff is your like red blood cells. Now, what would happen if I had more red blood cells? What would happen to that line? It would go up, wouldn't it? And if it went up, don't you think the percentage, right? Let's say this dotted line is normal at like around 45%, right? So if 45% was normal, and my patient now has way too many red blood cells, what's going to happen to that number? That number is going to do what? Get bigger. It's going to increase. So if that number gets increased, what will the ratio between your red blood cells and your what do you call that? Your plasma would happen? It would do what? Increase. So if the hematocrit increases, you either have what? Too much red blood cells, or remember the hydration status, too little plasma. So that's what happens when you have an increase in your hematocrit. And when you have a decrease in your hematocrit, the exact opposite. That was a hard one. I did that one on purpose. That's a hard one, and that's a classic NCLEX question.
So what was the answer?
Answer is what? Right here. What would happen if you have a lot of red blood cells? The red part will do what? Increase. So what will happen to that number, 45, which is normal? What would happen? It would go up. It would increase. Therefore, your hematocrit is what? Increase. Right? Now, let's look at the other side of the equation. Imagine all this part here. Let's color it yellow. What will happen to all the plasma? If the 45% increases, what will happen to the plasma? It will what? Decrease. So this patient who's polycythemia, right? Let's answer a BSN question, a real BSN question. My patient has an increase of their hematocrit. 45% was normal. Now it's up to 50, 52%. What happened to their plasma? It decreased. Therefore, is my patient dehydrated or has edema? What happened to their plasma? It got what? Smaller. So now they're what? Dehydrated. So what are you going to do to that line? You're going to inform, of course, your chain of command, and then you're going to do what? You're going to slow the line down or stop it. And that's your job. And you need to know this concept. All right? So that's hematocrit, hydration status of your patient based on the ratio between what? The formed elements, which is the red stuff, and the plasma, which is the yellow stuff. You will see it again, and then you'll ace it on the big exam where it counts. But admittedly, that's a really good question. Now, which of the following formed elements deal with hemoglobin? Right, of course, that was an easy one, erythrocytes. Majority of you guys got that one right. The next one, got hit again. Now, remember the diagram with erythropoietin? What were the two organs? Liver and what? Kidney. Why did half of you answer liver and spleen? Because again, game show mentality. I saw liver, which I know is the correct one, and the and. Well, that's good enough for me. Boom. But then Was it precise? No, it wasn't. All right. So again, if you see a K question, both A and B, neither nor, slow down. You are now being led astray on purpose, right? Because could it be one or the other? Could it be both or could it be neither? Right? Slow down. It is never neither and it's never always both. It could be anything, but if you do your process of elimination, you'll never get hit. I knew that would get you too. Knew it. Number 7. Signal to stop erythropoietin. A couple of you got that wrong. Again, we went over that in class. Any process, you got to know the what? The beginning, the middle, and the end. And what did some of you do with the end? Yeah. Right? Think about what erythropoietin means. Erythro means blood, poietin means production of. When you want to make more blood, right? So what did you start at? High or low oxygen? Low oxygen. I asked about the negative feedback. When do we turn this thing off? When the oxygen is what? High. So oxyhemoglobin is high, not low. But 3 or 4 of you got hit on that one. Right? Oh, by the way, one of you who got the 90s got hit on that one. You went, I know you know the concept, but again, knowing the concept, and that's why go through the process of elimination. And if you forgot what that was, I put it, especially for the students who didn't have me last term, how to answer a multiple choice question. It just takes a minute or 2 to watch it, but developing that skill set will save you so much grief, because right now, many of you who I emailed on your on the topics you got wrong, you're like, but I knew that. But are you following the protocol? Because if you don't, that's it. Remember what we always talked about? That, yeah, I studied really, really hard, but why did I get it 76? Because you got fooled by the questions. Oh, this is another one, right? Product of the breakdown of globin portion. I even wrote the word globin in quotes to make sure you looked at it. I even wanted to bold it. Hemoglobin, is that the, heme is the iron part. Globin is the protein part. When I break down globin, what do I break down proteins into? Amino acids. I don't know why 5 or 6 of you wrote bilirubin and biliverdin. I know why, because that's the question that tripped me up on that slide. And every time I think about that concept, I'm only going to think about the answer, bilirubin or biliverdin. But did I ask anything regarding a pigment? I asked about the what? Globin, the protein part of it, which is, of course, amino acids. And you'll see it again because we're going to go over GI, which has metabolism in it. And guess what's right after chapter 18? More metabolism. So get the concept down that proteins break down into amino acids. Fats break down into what? Triglycerides and fatty acids. And carbohydrates break down into to monosaccharides, sugars. We're going to be seeing that like ad nauseum. Oh, this one. Oh, so that one, that was the tricky one. That was rough. So a whole bunch of you got that wrong. Maybe more than half. Number 9. Oh, here we go. Heparin and histamine. Why, oh, why, oh, why? Because you guys saw that CD8 and CD4 cells. Do CD8, CD4 cells, or T cells, or even lymphocytes have anything to do with inflammation? They do, but it's what? Because the second you see histamine and heparin, what are you thinking immediately? It's inflammation. I have no idea why people answered production of CD8 cells and CD4 cells.
I thought it was a trick question because inflammation is histamine, not heparin. But like, I guess it is.
No, but inflammation is also heparin, because can the white blood cells get to the bad things if the blood is thick? No. So, and basophils and mast cells both deal with inflammation, and what do they both release? Histamine and heparin. Those two are cousins. They always go together. Next one. And if you start thinking it's a trick question, it's not. You're tricking yourself. The majority of the things that you guys got wrong, you tricked yourself. I didn't have to do anything. This guy did it all by your lonesome. Oh, here's another one where you tricked yourself. I told you guys, look at the terms, right? Be able to differentiate the terms. And even during the review, I said, there's a big difference between diapedesis. Dia means what? Peds means to do what? Step out and walk. Chemotaxis is what? The chemical attraction that forced the white blood cell to walk. So, but everyone saw what? Oh, those are the terms. They saw white blood cell. So some of you hopped on diapedesis. And also, you guys remember, I answered what? I had like, it was on a quiz. It was on also one of the questions that we went over that Tuesday. So what do you think I'm going to do for the exam? If I kept on asking you diapedesis already, of course I'm going to ask what? The other term that I didn't ask. Right? And also look at the word chemotaxis. Chemo means what? Chemical. It's the chemical. And I remember I said it's really important. You got to know chemotaxis. Chemotaxis complement. That's the thing that attracts the white blood cell to where it goes. And it's important because where do we find complement? Where do we find immunoglobulins? I find it where? Goes in my plasma proteins. And if I have a whole bunch of complement in my plasma proteins, if I have a whole bunch of immunoglobulins in my plasma protein, what does it mean? It means there's what? There's trouble, right? And it's attracting white blood cells toward that trouble. Number 12. Oh, this is another thing. Remember I said, once you see a modified true-false statement, what do you need to do? Read each one. Don't hop on the first true one, right? Because you have to do all of them. And then when you do all of them, one of them will stand out. So true regarding the macrophages. We already know monocytes make macrophages. But some of you believe that the red pulp makes macrophages. Red pulp is what? White, a red blood cell. What's a macrophage? It's a white blood cell, right? They're derived from the thymus. Macrophages aren't derived from the thymus. Some of you went, hey, M, megakaryocyte, M, macrophage. That's good, right? There was a wide array of answers for number 12. So remember always, monocytes. I bet you anything, if I made it a simple question, which of the following is derivative from monocytes, you'd get the macrophage really quick. But then I started putting things that what? Again, distractors. Do your process of elimination. You'll and go slower because then you'll start realizing some of these other answers are so far off the beaten trail that they're not even worth your time. Required for hemostasis, everyone did that good. Good, vitamin K and fibrinogen. Hey, that's funny. How did you guys get that question, but not the fibrinogen question? Oh, that's amazing, right? Accumulation of plaque in your arteries. Now, of course, it's going to be, remember what I told you guys. Every time I do a medical terminology question, I pick a word that's right next to it. So arteriosclerosis versus atherosclerosis, right? So which one's arteriosclerosis just means what? Hardening of the arteries. But your atheroma, right? Now, I can understand, I can understand if the new people got it wrong, but you know what's funny? New people didn't get it wrong. Right? All the old people should have got it right because how many times did we mention an atheroma or a fatty plaque last term when we did the presentations? Right? No, 2 or 3 times because remember, hypertension, hypertension and fat is a big, big thing in the majority of diseases.
What was it?
Yeah, it's atherosclerosis because athero means what? Fat, fatty plaque. And what happens to fat when it goes bad? It turns into stone. That one you did okay. This one you did horrible, which is all the blood stuff. So you know what? I'm not supposed to show the question, but let's show the question. All righty. When you're looking at that, it's the same wells. It's always the same wells. Anti-A, anti-B, anti-D, right? So if you have agglutination, which you see here, see the clumping? So they have one on the red blood cell. A or B? A. You have agglutination here, clumping. It goes, what is on the red blood cell? B. So the ABO blood typing is what? AB. Now, the anti-D is your RH, right? So anti-D, so they're AB what? Positive. So was that the question? No. The question was what? Because which of the, oh no, it was. It was a straightforward question. I still don't know why a whole bunch of you got it wrong. That wasn't even the hard one. The other one was the hard one. I answered 4 picture ones because I looked at previous exams and everyone gets these wrong. So let's look at this one. And it asks, which one was the universal donor? So right off the bat, before I look at any patient, who am I looking for? Am I looking for A, B, or a type O patient for universal donor? Universal donor, right? 2 O's, so O. So what's so special about O? Do they have any antibodies? No. So I'm looking for what? An anti-A and an anti-B that has no clumping. Which one has no clumping? An anti-A, anti-B. Patient what? 4. Right? Now, did you see what we did here? You look just like the how to answer a multiple choice question. You look at the question. You ask yourself, what does the question ask of me? What does it want of me? It wants the universal donor. And then I say to myself, okay, what does universal donor mean? And then what? Find the answer. Did I have to do D or do any of this other craziness? Right? Which probably messed you guys up. Probably looking at all these other options when the option is now when you look at it that way. Now, could I have done which one is which one would be the best universal recipient? It would be patient who? 3. Because remember, what's a universal recipient? A, B. It would be better if it was A, B neg, but that would be the best answer. How's this for a question? My patient has A blood. Out of these patients, it goes, who can't we give it to? Can I give this to an A person? This one? So patient 1? Can I get blood from patient 1 or donor 1? Sure. Goes, how about donor 2? Can I give it? Nope, because this will interact, right? And goes, how about patient 3? Nope, right? But patient 4 is universal donor. I can give him to anybody. So again, picture, look at the pictures. You'll see it again for the final, definitely. And oh, by the way, you'll see it definitely again for your what do you call that? For your lab. Now, what was the other one I asked? Oh, this one you guys did a little bit better on. I have a patient. Which one? You know, rogamuglobulin we give to what kind of we give to pregnant mommies, right? But which pregnant mommy? Now, let's say you didn't know anything, right? You know that HDN deals with what? RH. So what's the only column you're going to think about? Is the anti-D column. Which one of these things don't match? Patient 4. So patient 4 is the patient 4, the only one who's gonna get Rogam, because remember, who has the antibodies or who has anti-D antibodies? Mommy or baby? Oh, remember the picture. She was negative. Mommy didn't have anything. Who had all the little Y's? Baby. And how's this for another follow-up question? Who's going to get sick, first baby or second baby? Second baby, because the first baby sensitizes mommy. And that's actually how all allergies work. You got to get hit first, and then you get the signs and symptoms later. So look at those pictures again. You're going to see it. Ooh, I thought this was an easy question, but you guys got hit on it. It's pulmonary versus systemic circulation. Why can't it let me not draw? All right. Well, I'll just say it because it won't let me draw it. Pulmonary versus systemic circulation. Which one is left-sided? Systemic, right? Okay, now you got that part, right? The left side of the box diagram, was it red or was it blue? It's red. Therefore, is it oxygen or carbon dioxide? Oxygen. So of course, here it goes. If I'm asking for carboxyhemoglobin, am I talking about the left side or the right side? CO2. I'm talking about the what? The right side. Right? And one of you answered both for whatever reason. But a lot of people did the pulmonary and systemic circuit. Next one, you guys did pretty good on this one. Which one does gas exchange? Of course, capillaries. Majority of everyone got that one. Right? This one, oh boy, everyone got hit on this one. Peri means what? Surrounding. Epi means right on top of. So if I had my heart here, right? Epi means right on top of this, and then peri means surrounding. And also, you know that the fibrous pericardium has a what? 2 layers, and one goes and the layers on the outside, visceral versus parietal is what? A tough layer. Remember? So if the pericardium is the tough outer layer, the epicardium is right on top of the heart, then who's got to be on the outside? Pericardium. You guys switch that up. I thought that was a gimme, but yeah.
I feel like if you would have said fibrous pericardium, I would have chosen that.
Then I would be, that's like saying, he goes, which is the tough layer? Tough layer. That's like doing that. I thought, I don't know. I thought that was a gimme. Which of the following is connected to your left ventricle? You guys did pretty good on that. That means you guys are doing the box. So of course, left ventricle, of course, aortic semilunar valve. If it's right ventricle, it's pulmonary semilunar valve. You also got this one you did pretty good on. What does your superior vena cava empty into? Everyone got that. That's right atrium. So regarding the anatomy of box questions, you guys are pretty good on. But review the oxygenated versus deoxygenated again. The next one, a couple of you got hit on this, and I think I know why, right? Because it's easy to look at if you're looking for something that's positive. But again, process of elimination. I asked, which of the following is not an oxygenated blood vessel? And right off the bat, you saw pulmonary vein and pulmonary artery, right? So you have to ask yourself, right? So what's not oxygenated, that means I'm looking at what? Deoxygenated. So between pulmonary artery and pulmonary vein, which one's colored blue? Pulmonary artery. Remember, it's coming out of your right atrium, pulmonary artery, which is part of your pulmonary trunk. So that was the answer. A couple of you got hit on that one. Next one. Oh, this one as well. Again, I asked, instead of asking find the true statement, I switched it up and said find the false statement. And it came down to pressure. And remember we were talking about the love dub? The atria, do they have a lot of pressure? No, because remember, the blood just falls in. But remember the ventricular walls, weren't they thick? Weren't there a lot of trabeculae carne, and they have to pump against the lungs on the right side and your systemic blood pressure on the left? So it's going to be what? High pressure. So what's the opposite of true for that? It'd be what? Low pressure. And remember, systolic versus diastolic. Systolic will always be the what? Higher number. Diastolic is the lower number if your blood pressure is 120/80. So what 120/80, which one is where your ventricles are contracting? Systolic, high pressure. Diastolic is when your atria are doing what? Filling. So it's like a kind of like a double negative. A little bit tricky, but I'm such a proponent of if you did your process elimination, you would have eliminated your distractors. Next one, a couple of you mixed up SA, AV node, not many of you, 1 or 2 of you, but remember, SA node is the pacemaker, AV node is the brakes. They're both located in your right atrium. Next one. Some of you got this one wrong as well. P wave. What's the definition of a P wave? Atrial what? Depolarization. So if I have a P wave problem, where's my problem? Atrium. I have no idea why some of you said both. I have no idea why some of you said ventricular, but just know your waves. Next one. And I can tell you right now, if it's just that when you get used to the process, you start cutting corners. Don't cut corners when you're doing test taking protocols. The straight up question, the ventricular repolarization question, everyone did well. Everyone got that one. But if I just change the words around, then you get it wrong. So do your process of elimination. Here's another one. What is true regarding the S1? S1, S2. S1. What's closing on your first heart sound? AV valve. S2. What's closing? Semilunar. So that was that question. Oh, I know why you guys got that question wrong. A bunch of you got that question wrong because bicuspid and mitral valve, is that all of the AV valves? No, that's only the what? Left side, right? What about the tricuspid? Remember, bicuspid and mitral valve are the same thing. So if you said bicuspid and mitral valve only, is that correct? Versus someone who said bicuspid and tricuspid. Again, the little details you're starting to miss because now the questions versus last term are no longer straightforward, right? You have to check each thing and never assume that something's routine. Our patient has an abnormal S2. You guys got that good because even if you didn't know anything, pulmonic semilunar valve was the only thing that sticks out at that question. Number 30, which of the following parts of your brain control your SA node? You guys did well on that. Of course, that's the medulla oblongata. The next one. Oh, heavens to Murgatroyd. I thought we got this down. All right, let's draw this out. If I have diabetes, how's my blood sugar? It's high, right? So I have a lot of sugar. What does that turn my blood into? Does it make it thick or thin? Makes it thick. So it turns it into molasses. Now, molasses is thick. Therefore, what does it mean regarding viscosity? So the viscosity goes up. Now, if my viscosity goes up, what happens to my blood pressure? Will it go low? No. It'll do what? Go high. And didn't we mention this? Why almost always diabetics will have associated hypertension? And you don't have to memorize it. Know and understand that if I got a lot of sugar in my blood, I'm pushing out molasses. The viscosity will go up, and if the viscosity goes up, turbulence goes up, blood pressure goes up, right? So the blood has what? High viscosity, high blood pressure, and it shows the direct correlation between how thick your blood is and your blood pressure. That's why any heart pathology, why do you think we give them 81 milligrams of aspirin? Or if it's really bad, we give them heparin or TPA. Because if I thin out your blood, what will happen to your blood pressure? It will go down. So remember, you could sit and memorize all of these things and potentially barely pass pharmacology, or you understand how we play with things regarding anatomy and physiology. I thought that was a gimme. 33 is a bonus because I got the key wrong. But essentially it was, majority of you got it right. That's also how I identify things. If like a whole bunch of you get it wrong, it looks a little weird. And it talked about venous blood flow, something similar to this, of course. And of course, what happens if there's vasoconstriction? What happens to the blood pressure? Goes up. If there's vasodilatation, what happens to the blood pressure? It goes down. Now, just like a hose, I start squeezing, how much water comes out? Does a lot of water come out? No, it'll stream out, right? Under high pressure. But what happens when I totally let go of the hose? A lot more water will come out, right? So that's also another concept that we're going to be talking about, especially in gastrointestinal absorption, which is the lecture for today. And
Wasn't it skeletal muscle contraction too, though?
no, it was visceral muscle contraction helps venous flow because yeah, that was a venous flow question. But the key is wrong, so whoever got that thing wrong, you're gonna get it right. So no,
That was 33.
yeah, that was 33. Next one, a whole bunch of got it wrong. Lacteals. Remember the three functions of your lymphatic vessels. One of them was in the GI, which is to remove excess fat. Removing excess fat, does that have anything to do with your immune system? No. So why would you write immune, right? Also related to the other question, your Peyer's patches, of course, are in your GI, but your Peyer's patches, is it a digestive function? No, it's an immune function. Because what's malt? Malt is what? Again, people going, Peyer's patches, ileum, GI, without thinking. That's a reflex. And those of us who had my lecture last term, a reflex, does it require a brain? No. Reflex medicine and reflex decision making, that's a killer in the ward, right? Think about what you're doing at all times, even if it is routine. Because I can tell you right now, it's the routine stuff that'll kill you. So think lacteals. I want you to think what? It is part of your lymphatic system, but it is not the immune part of your lymphatic system. It is your lymphatic system's way of picking up all the extra fat from your GI. So that's your lacteals. What's the other part of the lymphatic system? Remember, prevention of edema has nothing to do with the immune system, right? So out of the three functions, you have an immune function, of course, with the lymph fluid. Then you have what? Lacteals, which is fat. And then the third one, prevention of edema. Next one. You guys did good on this one. I said, where would you find albumin? Of course, that is in your plasma proteins. Next one, you guys did pretty good. Which one will prevent backflow? Both veins and lymphatic vessels, both. And for the one or two of you got it wrong, you picked either lymphatic vessel or veins, but it's what? It's always both. Because who looks like each other? Veins and lymphatic vessels kind of look like each other. They're both relatively thin. They're both under low pressure, and they both have valves. Next one. Oh, this is the Peyer's patch question. A whole bunch of you got that one wrong, almost half. Remember, Peyer's patches, malt. Malt is immune function. Source of your B cells, of course, bone marrow. Everyone got that one right. Oh, killing me. Someone even asked that question in class. First line, second line, third line. What's your first line? What's the first thing that when bacteria hit? Skin and mucosa. What's the second line? That was a whole entire slide. That's what? Inflammation. And what's your third line? All your adaptive responses, which is what? B cell, T cells, antibodies. Right? First, second, third. I thought that was a gimme too, but it was wrong. Next one, adaptive immune response. You guys got that one, of course, antibodies. Next one, most of you got that one correct, histamine and heparin. And that's funny. Most of you got this one, the histamine and heparin question correct, but the other one in the first third of the exam, you got it wrong. That's funny, but at least goes to show that you know the concept. Next one, which of the following block viral replication? What's another word for blocking? Interferon. Therefore, an interferon. One or two of you got that wrong, but that's okay. Now you know. Next one, the immunoglobulins. Remember I told you guys how to misspell in immunology allergies? You spell it allergies. So it's what? IgE. IgA is what? secretory. It's what's in your secretions of your skin and your tears. IgM, think what? McDonald's, food. IgD, I don't know who that is. IgG, think IG generalized. First one in, and also it can hit anything. And of course, what's the other one? Oh, that's about it. Next one. This one too. I know you guys get artificial versus natural. You also get passive versus active. But what did I do? Put them together. So what do? You do your process of elimination. So when you look at a booster, right? You get your shot. Is it artificial or natural when you get a shot? It's artificial. Everyone got that part. Active versus passive. Because active is when you actually get the disease, you go through all the rigmarole, and then get what? Actively make antibodies. Now, did you get sick? Remember, I specifically said in lecture, 99.9% of the time when you get sick from getting a booster shot or any any vaccine, it is not the attenuated virus that you got sick from. You got sick from the additives that the drug company put in there to extend the shelf life of the vaccine, right? Remember we talked about that? That's what you get allergies on. It's not because when we give you the jacket, we don't even give you the whole jacket. We give you a thread. When we give you an attenuated virus, it's not even the whole DNA or RNA of the virus. It's a piece, right? And not really enough to make you what? Sick with the actual disease. Now you may ask, but Dr. Garais, doesn't people who get the flu vaccine, they get sick? Because remember, if you get sick from the additives that are in the vaccine, right? Or the stress of you getting shot and the pain of being, isn't it annoying when you get the shot? It's intramuscular. I was at CVS the other day. The lady was gumming up the line because she had like 1,000,002 questions about the injection, right? Which were all legit. It's painful, isn't it? And what this pain will do? Remember, it's going to lower your inflammatory, lower your immune response. And when you get that flu shot, is it good for all the flus? No, don't freak out. There are more than 2,000 coronavirus that could kill you. And they're influenza A and B variants. But no one tells you that, right? You take the shot, roll the dice, and hope that the shot covers the variant that can kill you, right? But again, right, it's better than what? Nothing. If you're walking around with nothing, the odds of you getting hit are much, much higher. So what's the answer? Artificial, of course, and passive. If it was active, someone had to get what? Actually sick, go through the whole rigmarole, and then do what? Actually make antibodies. So think that, active, antibodies. That was a hard one. But process elimination, I believe you should have got it. 46. Oh, this one as well. Remember we talked about the thugs? What do thugs do? They eat. Who are our thugs? Weren't they macrophages? NK cells, and who else? Is it the T helper or T cytotoxic? The T helper was the tattletale. All they do is, hey, kill this guy. It's the T cytotoxic. So what were my choices? T helper, T killer, both or neither. And a lot of you picked both. How can it be both? Both of them have different roles. It can't be both in cellular immunity. So think what? CD8 plus, killer. Kills how? Phagocytosis. Who are my other thugs? NK cells, macrophages. And last but not least, oh, this kills me. How did you get the hypersensitivities wrong? Let's review. Which one was the first story that I talked about? My shellfish story. That means what? I had anaphylactic shock. So that's type 1. Right? Type 2 was what? The serum sickness. If antigen antibody, right? They start fighting each other. That's two parts, isn't it? That's serum sickness. That's if I have a mismatch in blood. And then type 3, rheumatoid arthritis. It's when foreign body or something that your body thinks it's foreign and it doesn't like it, and then it will attack it. And last but not least, I told you the story about I got some poor girl from cheap bracelet, and what happened? In 48 hours, she got like really bad rash and really bad things on her wrist because it was delayed. So 1, 2, 3, 4. I thought that was a gimme, but several of you got hit.
I was gonna say, what's an easy way to remember that? Because
Well, 1 is what?
anaphylaxis.
A, anaphylaxis. 2, there are 2 parts, right? You have the donor and the recipient. 3, we talked about rheumatoid or any of the arthritis. Arthritis is from, well, sorry if I assume you guys knew this from last term. Remember we talked about last term? The synovial fluid is what? For most of you right now, is nice and clean. Get to my age and do what things I've done to my bones. What happens? Some of the cartilage rips out, some of the stuff, and then it gets dirty. If it gets dirty, your body starts looking at the dirt as what? Foreign body, and it will start attacking it, and then you'll get arthritis. And that's what? Type 3. And last but not least, it's the last one, so that's got to be, if you're always last, you're always what? Delayed. Now, you see how, well, that's my way of thinking, right? Regarding memory, and for the students who didn't have me last term, there's a video that I put down. If you have issues with memory and how to study, please look at that. It's an announcement. But I'm going to share with you guys, the new people, again, what I shared with the old people. Remember, have any of you, most of you have lived or been in a place where you that you recognize the neighborhood, like you know the joint like the back of your head, yes? So what can you do if you have something like this, right? Now, it's easier to remember like a picture. So think about this block on your street or a place that you remember. And there's 4 places, right? 1, 2, 3, 4. 1, right? What picture can you have? Right? And I know this is a rough picture. Think of me like what? Buck naked in the ER, all puffed up, right? I'm all red, I can't breathe. That's what? That's the anaphylaxis story. That's in the first house, yes? The second house, you could park a what? A blood donor truck in the second house, right? The third house, do you think you could put crutches because if you have arthritis, you'd be limping around? And the fourth one, you think you could put a clock on the fourth house for delayed because you're late, right? So what do you have? Now you close your eyes. What was in the first house? Me all blown up. What was in the second house? Blood donor truck. What was in the third house? Right? Crutches, arthritis. What was in the fourth house? A clock, a big clock. So now do you have the 4 classifications down? Another thing that's similar to that as a memory trick is it's called your mind space. Same thing. If there's a room in your house that you remember, do you think I could have something similar? Like for whatever reason, I always remember my basement because I'm always gaming there, right? Do you think I could have 4 games there, right? I could have 1 game that's in the first one. I play this game called Fat Princess on PlayStation 4 all the time. So don't you think that this would be first? And then the second one, right? It would be 2 things, like a donor and a recipient. I could put what? 2 little twin stars there. And then on the third one, arthritis. I could put my crutches on that chair. And then the fourth one, a clock. So I go into that room. What do you see? You see the 4 things. It's easier and more relatable. So the key to any of these memory things is something that's relatable to you. And that's how you remember. Another way that other people do it is you have 1, 2, 3, 4. So 1 is anaphylaxis. 2, you're going to say blood. And let's see, arthritis would be 3. So that's A, B, A, and delayed type would be last. So do you think you can make an acronym, A, B, A, D? But the problem is, once you start grabbing up acronyms, they start multiplying. We had a game in medical school. We wrote on the board all the acronyms when we were in 3rd grade of medical school. It filled the wall from here to here, every acronym that we all learned. It's insane, right? But you know what's funny? The majority of them you remember because you remember within the context of your own memory. So even though I'm giving you examples, the ultimately you're the person who has to commit these things to memory. So that's it. Not bad. It's 80, but you can now see that the concepts that we have to apply that weren't too difficult. I believe when I'm looking at it, for some of you, it's a rush job. For others, it is I believe, of course, the game show mentality is coming up, right? You see bits and pieces of of the correct answer, and then you jump on that. Don't do that. Fight that urge, and just keep the discipline of read the question. Grab what you need in the question. What is the goal of this question? Then do your process of elimination. Once you have your process of elimination, test, right? Now, the good news is when I'm looking at it, those of you guys who were switcheroos last term, you don't do that anymore. You now solidly pick the wrong one. You don't do you solidly pick the wrong one. Like that, right? So now you know which one's definitely the wrong one. So come final exam, which is 20%, you won't fall into the same trap. And now you know what these traps look like, which by the way, all right, look a lot like ATI traps, doesn't it? And that's why, and don't fret, I made this one spicy, so I'll make the one medium spicy, the next exam. And then the next exam of that, gotta make it spicy again. And then medium spicy. And then we put it all together, what do we get? Just like last term, the final exam was what? Beautiful. What was your class average? Final exam, what, 90, 91 last term? Why? Because of the after action, because you fix what's broken and then come the final when it counts. Now, how many of you here have been to your typical college with 100 people in the room and only a midterm and a final? That's going to be graduate school or whatever other school you guys end up in elsewhere. So what do? Don't you think you make your own mini tests and your own little mini things? And then what will happen? Did you ever wonder how these people ace their midterms and finals? And here's the other thing that I'm telling my seniors, right? Never do it alone. When you guys move to the next class and find out who your professor is, find everybody in the same uniform as you, especially the ones who look tired and talking to themselves in the hallway or crying. You ask that person, just 5 minutes of what's going on. I told AMP1 people, but AMP2 people, my daughter had straight A's since the day she was born. I don't think she got anything less than an A-. And I can tell you why. It's not because she's smart, right? Because I've been teaching more than 20 years, because she's not the sharpest tool in the shed. But she's the hardest working one, and she keeps to a protocol and keeps to a discipline. So when she was preparing for her NCLEX, 7 days a week, 8 hours a day with a full-time job. And she kept to that discipline all day, every day. So what happens? You get used to it. And then what happens when the real thing comes? It just becomes like practice. And I always tell the same story. I was looking for her in the test center. I didn't see her. I'm like, where the hell is she? She was outside. She finished early. She was outside having a Danish, looking at me going, can we go to the mall? And acting like what? Like nothing happened. When you see other people come out of NCLEX, they're like, they look like somebody did something to them. They look like they've been assaulted. Emotionally, mentally. When I came out of my MCATs, I tried not to cry, but when I was driving down the road, Route 4 on my way home, I was like, oh man, right? And then I saw my score, it wasn't half bad. But my daughter was confident. She goes, and I go, how well did you do? She goes, we were just driving to the mall. And she goes, yeah, I aced it. And she goes, it was easy. And I'm like, don't be arrogant. And then came back on 92 percentile. 92 percentile means her score beat 92% of everybody in the world who took it on that cycle in the world, right? But you know what's funny? When she interviewed for a job, do you think they cared? As long as you pass. What they care more about? Do you play nice in the sandbox? Are you an a-hole? Right? I go, how do you deal? A lot of the questions for my daughter was, how do you deal with stress? Right? I go, and do you piss people off, especially your supervisors? Right? Yeah, question.
What do you do on Monday nights? Like, for maybe an hour.
Well, yeah, make the, what do you call it? Make the request, because remember, even if I'm not here, you make the request, right? My only responsibility is to this group. So if you guys are like work or something, hey, 7 o'clock, 8 o'clock or whatever, right? You guys know I don't do stuff until like Thursday night. And Thursday night, if you want to talk to me Thursday night, it's got to be in between songs and stuff. So I'll be like, go in and go, okay, this is the thing you have to do. And I've done this. Like, I'm party rocking, and then they're looking at me. What are you doing? I'm telling you the formula of metabolism. You hold on. This song's got 1 more minute. I know what I'm doing, right? And now I'm teaching my daughter how to DJ a little bit because I need somebody else to do stuff for me. So make the request, like, hey, and then I'll put it out on announcements. Hey, I'm doing a session at 7 o'clock Monday night. Who wants to come aboard? And we'll do it on Teams. And we could do the same exact thing. Because remember, my only responsibility is this room, right? Like, it's the neat thing about this place. I'm not on any of the committees. Oh, I'm on other committees, but I can totally blow them off. All I have to do, it's hilarious. All I have to do is say to Mr. Roboto, oh, I got tutoring. No, okay, that takes forever. Any other university, like, no, you have to be on this curriculum committee. You got to be on this. I'm like, oh, and that's what I do. I always tell the seniors, because I have meetings Friday afternoon. You know, Friday afternoon, we're all kind of out the door. I tell my seniors, Friday afternoon, 2 p.m. on Teams. Let's go. Or Saturday morning. Oh, I can't do Friday afternoon because I got Saturday morning.
So like this Monday coming up at 8 o'clock, are you maybe free?
Yeah, shoot me a formal, so then I can put it out, and then you guys come up. And also, what can I also do? I can record it, and then it goes, you guys, if you want, I'll put the recording on. We can make as many videos as we want, and we could do, remember, the pandemic taught us a lot of stuff. It taught us we can do whatever the fudge we want, from wherever we want.